Growing fears about the impact of the far-left agenda on your health care, as critics warn future doctors are being trained to consider race when they're prescribing potentially life-saving treatments. In an op-ed, our next guest calls to keep politics out of our doctors' offices, arguing woke ideology and policies have become quite literally a hazard to your health. And he's launching a nonprofit now to fight back. Do Not Harm Chairman Dr. Stanley Goldfarb joins us now, along with the group's Executive Director, Kristina Rasmussen. Thank you both for being with us.
Good morning.
Good morning. Dr. Goldfarb, you have this great op-ed this morning in the Wall Street Journal, and it talks about how our healthcare system is going woke. Give us some examples, because a lot of Americans don't know this.
Yes, well, thank you very much for having us on. Yeah, the same initiatives that have come to K through 12 education and have come to even the way that police should behave has come to health care. And the idea that that anti-racism and critical race theory have been injected into the doctor's office now, I think, is a real phenomenon. And you should understand that, as the prophet of critical race theory, Ibram Kendi, has said that any past discrimination must be dealt with future discrimination. And this means that patients in the future will be discriminated against in favor of one group over the benefit of another. And one, I think, example that we've just come through in the COVID-19 pandemic was the fact that several healthcare systems and states had even developed algorithms in which a patient's race would determine whether they received rare, scarce medications such as monoclonal antibodies, sorry,
That's okay.
As treatment. And this obviously is a terrible sort of initiative to occur to medicine. Patients need to be treated as individuals. They don't need to be treated as part of a group. And the only results of this kind of activity is to undermine the trust that patients need to have in the healthcare system. So part of the problem, I think, with poor uptake of the COVID-19 vaccines in the African American community has been this constant drumbeat that healthcare systems are racist and that physicians have been racist, and that's the reason for disparate outcomes between black patients and white patients in the past.
Kristina, tell us about the nonprofit that y'all have started together and how that can help patients.
I'm happy to. Do No Harm is a network, a coalition of doctors and nurses, medical students and patients, administrators, people who are really concerned about woke ideology spreading in the healthcare system. And we're here to help people. If you are a healthcare worker and you have started to see critical race theory creep into your workplace, maybe you're being forced to go to bias training or lose your job or start to implement some of these discriminatory practices, we want to hear from you. In some cases, we may be able to help with litigation or advocacy or investigations. Our website, donoharmmedicine.org, has a place where you can share your concerns, even submit an anonymous tip. We know that the woke mob can try to bully people, but at Do No Harm, we are unafraid, and we're here to help people who want to do the right thing.
Kristina and Dr. Goldfarb, thank you all for being with us. If you want to read more about this, check out the Wall Street Journal, his op-ed this morning. Thank you.
Thank you.
Thank you.